increasing numbers of people are infected with AMR pathogen, causing a great deal of socioeconomic loss. So it is urgent to establish a research consortium that focus on alternative therapeutic to tackle AMR. The problem worldwide at the moment, the burden of AMR is rising significantly in Asia and especially in Thailand, because Thailand, we are regarded as a high risk region for the emergence and dissemination of AMR. So each year, increasing numbers of people are infected with AMR pathogen. Patients infected with bacterial pathogens are usually prescribed a standard set of broad-spectrum antibiotics, regardless of the drug susceptibility to the bacterium. So treatment failure with the first-line drug is increasingly common, causing a great deal of socioeconomic loss. So it is urgent to establish a research consortium that focus on alternative therapeutic to tackle AMR. Our research group aims to use a multi-pronged approach that investigates alternative strategies to combat AMR in order to reduce the amount of antibiotic consumption and to extend the lifetime of currently used antibiotics. We work on Clostridioides difficile, which is a gram-positive anaerobic bacterium, and it is a major causative agent for antibiotic-associated diarrhea. We use different approaches, including phage therapy, reversal of the resistant mechanism, and also use the pre- and probiotics to tackle AMR as well. Initially, when we started, we collaborated with a hospital that affiliated with Mahidol University, and we found that a lot of patients got infected with the Clostridioides difficile. Most of the doctor would treat the patient directly without isolating those bacteria, and that can cause a resistance in a way. What we aim is that we collect the strain first, and then we characterize the genetic background based on antibiotic susceptibility, and we try to identify the potential mechanism that causes the bacteria to be resistant. And then we can use that mechanism to be our target for therapeutics. We received a number of the grants, like Mahidol University collaborating grants as well, and we also use that grant to initiate the network and apply for international grants as well. We publish quite a number of papers in international journals using different approaches as well, and we have collaborative network both domestically and also internationally as well. So our program would actually encourage between country partners as well to focus on AMR. So not just our lab or Mahidol University, but we have the international collaborative network to tackle the AMR as well. We have to say that our data kind of guide the way to preclinical trial. So basically, we have the different approaches. Our integrated molecular data obtained from our study would benefit the design of preclinical trial, especially the targeted therapies for specific driver events. So our genomic assessment of AMR isolate, in this case is Clostridioides difficile, by finding the signature and also finding the phage island would be valuable information for programming effective prevention and also design alternative routes for treatment of AMR microbes as well. Our project would contribute to economic development and social welfare in various ways. One of the immediate outcomes is to improve patient care. So antibiotic susceptibility testing is time-consuming and costly. Therefore, treatment without the proper diagnosis is common. The knowledge gained in our project will lead to targeted strategies to combat AMR in specific pathogens. So in our case, we use Clostridioides difficile as the model. So personalized medicine promises to improve clinical outcomes by using the knowledge about AMR mechanism to identify appropriate treatment of infection. We already established a consortium internationally, so we aiming to get more funding from international agencies as well, and to expand our work to develop alternative therapeutic approaches in full aspect to generate data in various dimensions. So this way, each research group can broaden the expertise to other diseases relevant to the country's social welfare and economics.